The pain and lack of sleep associated with fibromyalgia can severely interfere with a person's ability to function in everyday life. It can both interfere at home, at work, and in any circumstance that they find themselves in. And it can be made that much harder when people around them don't understand what they're going through. Thus, any assistance or help that could possibly be offered by friends or family really does make a huge difference in coping with the daily struggle that living with fibromyalgia can be. So with that, myself and fellow YouTuber and friend Jennifer are going to speak from experience to share with you guys some basic information about fibromyalgia, as well as some tips that we feel would be really helpful for anyone dealing with this condition. So if that interests you, stick around.
An idea
can escape.
Ideas are bulletproof.
Fibromyalgia is a chronic disease characterized by widespread musculoskeletal pain, tiredness, and fatigue in localized areas. Many common symptoms experienced by someone with fibromyalgia include sleep, memory, and mood problems, numbness and tingling in hands, arms, feet, and/or legs, tension headaches, irritable bowel syndrome, and even anxiety and depression. Not a lot is currently understood about fibromyalgia, but thus far researchers believe that the condition amplifies the pain experienced by a person by changing the way that the brain processes pain signals. They basically believe that repeated nerve stimulation can cause the brains of those with fibromyalgia to increase the amount of neurotransmitters it's producing that signal pain. And unfortunately, along with not knowing that much about this condition, a lot of doctors can't really pinpoint exactly how a person got it, but they do know of a variety of contributing factors, one of which is, above all, genetics. It tends to run in the family, and thus, if you know of someone in your family who has it, you do have an increased chance of developing it yourself. Another is actually infections. Sometimes different illnesses or infections can trigger or aggravate fibromyalgia. And also physical or emotional trauma. Post-traumatic stress disorder is actually very commonly associated with fibromyalgia. As well as your gender, it is actually much more common for women to have fibromyalgia than men. And another factor many people aren't aware of is rheumatic disease can actually leave you vulnerable to developing fibromyalgia eventually. So for anyone who has those conditions, it's definitely something to keep an eye out for. And as I mentioned, this condition is incredibly hard to deal with, but that much harder when your friends and family don't understand what you're going through. The help that can be offered by friends and family is just pivotal in making this condition manageable. So Jennifer has some tips for you guys on how you can offer help to someone dealing with this condition.
Hi, I'm Jennifer. When someone close to you has fibromyalgia, it's often difficult to know what to say or what to do. So today we're going to be going over different ways that you can support someone that suffers from fibromyalgia or any chronic illness. Get to know the illness. Take time to learn about the illness on your own, or it can even be something that you can do together. Learn about the symptoms, like things that trigger it, coping skills, pain management techniques, diet, treatments, etc. Talk to your loved one and ask them about their experience. That way you might have a better understanding of what they're going through. Try to put yourself in their place and think about how your life would be if you were placed with the same limitations. By watching this video, it's a great start to learning about fibromyalgia. Also, if you need more help understanding the illness, I recommend reading The Spoon Theory by Christine Mezerandina. We'll leave the link in the description box. Validate their pain. Try to understand that the pain is real. It helps to feel heard, understood, accepted. Although above all else, what most people that suffer from fibromyalgia want to feel is validated. It might be tough for some people to understand the pain, but you can be someone in their life that does. You can't take the pain away, but you can make them feel heard. Offer a helping hand. Suffering from fibromyalgia can prevent a person from doing all the things they like to do in a day. Something that may seem simple to most people may be very difficult for a sufferer, like getting out of bed or putting on clothing. If you can, try to offer to do things around the house, cook, clean, shop, etc. Anything helps. Have patience. Fibromyalgia is something very difficult to live with. In result, it can cause a person to feel needy, sad, depressed, upset, angry. At times it may get frustrating, but please try to stay calm and try to do your best to be as understanding as possible.
And a final tip or suggestion would be to help them make a coping journal or a coping box. In the box they could put items that are helpful for their pain, and in the journal they could vent about the different things they're going through, or maybe take positive notes to remind them that life is good sometimes. There's various different ways that the coping box and journal can be used to help someone who's dealing with this condition. And Jennifer and I actually worked together to make a more extensive video about these two things and details about how you can use them. So do go check out her channel. I'm going to be linking it below, of course, with the video that we worked together on to explain the coping box and the coping journal further. So definitely go check that out. And if you've got anything you'd like to add about tips on coping with fibromyalgia, feel free to comment that below. If you're dealing with anything related to fibromyalgia, feel free to share about that. Or if you have any questions on how to support someone with this condition, please also feel free to share that below. And Jennifer and I will do our absolute best to try and answer anything that you might have to ask. Though we're not professionals, we're just speaking from experience having this condition. So we'll do whatever we can to help. And as always, please do join me again next week where I try again to share a little something I've learned in life.